Governor Mary Fallin will open the new legislative session tomorrow with her State of the State address. But before she speaks publicly about her plans for Oklahoma, she talks with 2 News anchor Russ McCaskey. And tonight's To the Point, the governor opens up about her vision for the Sooner State.
And we're with Oklahoma's Governor Mary Fallin. Thanks for being with us again.
It's always good to see you, Russ.
Let's talk a little bit about this upcoming session. This is your 3rd legislative session to be governor. What are some of the goals? What would you like to accomplish this year?
Well, we're going to continue to build upon our successes of the state of Oklahoma. When I came into office a couple of years ago, I talked about how one of my top goals was focusing on jobs and building the strongest business climate possible for our state, whether it was reforming our workers' compensation, our lawsuit reform, improving academic standards for our state, doing the things that would make Oklahoma more attractive to attracting jobs. And we've been successful about that. So I'm going to review with the legislature that the steps that we've taken, whether it's been the tax cut that we implemented, whether it's been prioritizing our spending in state government, whether it's been balancing our budget, and of course the different steps we've taken on government reform, that we've been able to now have one of the lowest unemployment rates in the nation at 5.2%. And when we took office, we had $2.03 in our rainy day account, our savings account, and now 2 years later we have over $600 million in our savings account. And we did all that by closing a budget gap, prioritizing our spending, and we did have a tax cut in the meantime.
All right, let's talk real quick about mental health. You can kind of look at mental health and what the options are here and where the funding is. What would you like to see happen with that?
One of the things you will see me discuss in our State of the State in a couple of weeks is mental health and mental health services in the state of Oklahoma. And you will see some increased funding in my proposal to the legislature in our budget to help deal with mental health crisis centers, with what's called systems of care, finding the right type of care for those who have mental health challenges in our state. You know, you can look in our prison systems, you can find those who have mental health issues that may have committed a crime. You can look at those who have substance abuse, drug abuse problems. You know, we know that Oklahoma is ranked as the #1 state in the nation on prescription drug abuse in our state. And so we're going to be talking about those issues. We're going to be talking about mental health, suicide prevention, prescription drug abuse, and of course just the general health of our citizens in the state.
And so you think something will be done this session regarding that?
I hope so. And over the last couple of years, I've put more money and more funding into mental health services for our state.
You know, recently you were in Washington, D.C. You're the incoming chair of the National Governors Association. And I guess one of the things that the governors are concerned about is that the federal government's going to try to cut the budget and put the emphasis on the state to come up and cover that, and that can be dangerous. Absolutely,
we're very concerned about that. I do have the great honor of being the incoming national chair of the Governors Association, and that position is an interface between the White House, the U.S. Congress, and the U.S. Senate. And so we go up and represent issues that we can find bipartisan agreement between our governors. And so we have some issues that we all share a concern about. One is the fiscal cliff itself. We understand that we need to reduce our deficit. I mean, we all agree upon that. We know there's going to have to be spending cuts in Washington, D.C., and there should be. But what we're asking the President and the Congress and the Senate to do is to give the states flexibility. We as states innovate. We are the laboratories of democracy, of creating ways to best meet the needs of our citizens. We're asking them not to balance the federal budget on the backs of our states. In other words, don't pass mandates down to the states without funding to match that. If you're going to have these mandates, give us some flexibility so we can do what best fits our own state budgets and what best fits our own unique needs of our citizens.
About 30 seconds left. In talking with President Obama, do you get the feeling that he understands what the states are going through? Is he willing to listen?
He listened, and he's cordial and proper as he should be as president. But as he stated to me several times when I was going through these various points about unfunded mandates and flexibility, and you know, we understand you got to make cuts, but give us some flexibility in what we need to do in our state. He also said, you can have all that as long as you meet my goals. Well, the problem is, you know, we don't always agree in Oklahoma with his goals, and so that's a real challenge for us.
Well, a lot of challenges moving forward. Good luck to you this session.
Thank you. Appreciate it.